Hi everybody, thank you so much for joining me today. I'm Dr. Tahir and I'm a board certified pediatrician. Today I'll be talking to you guys about what to do if you accidentally cut your child's finger while you're trimming their fingernails. You know, this is a really important topic because virtually every single parent I know struggles with this. You know, when you look at your baby's hands, they're really tiny, especially the newborn ones and especially the preemie ones. Their fingernails, their fingers, everything is on such a small scale. And also they're wiggly, so it's a moving target. So no wonder a lot of parents accidentally end up injuring their child's fingernails. And when that happens, it's really a very difficult situation for the parent, for the child too, but for the parent it can be long lasting. Let me share a story with you. So my first daughter was premature. She was a 28-weeker baby, and when we got her home, she was older than that, of course, but her fingers were really tiny. And so one day my wife looked at me and she wanted to cut her nails because my daughter was scratching at her face and not feeling comfortable with the longer nails. And so she was worried about what to do and how to do it safely. And I said, you know what, honey, don't worry about it. I'll show you what to do. Thinking, of course, I'm a pediatrician. I've done a lot of procedures for kids, etc., etc. And so I took her little finger and put it up by the light, looked at it really carefully. And I said, well, so what you're going to do is you're going to take a look at her finger super close in the light and take a nail clipper and gently go across and go zap. And as soon as I snipped, my daughter screamed. Oh my gosh, it was terrible. Blood dripping down her finger. I feel guilty to this day. That was 21 years ago. And so that tells you the importance of knowing what to do if this happens to you, because it really can happen to anybody. In fact, just last week I saw a couple that came in and brought their baby. They were absolutely devastated because when they were cutting their baby's fingernails, they accidentally snipped part of the skin, and that baby still had blood coming out, and the baby's parents had tears coming out. So if this does happen to you, just know that you're not alone and your baby will be okay. So let's take a look and see how this happens. When you're trying to cut a tiny fingernail, you'll want to take a look at the finger from the side so you know how much nail to clip off. Sometimes you could be moving closer and closer to the fingernail and accidentally cut too much of the fingernail. This can happen if you push the clippers a little bit too far, or if your child moves their hand, and that can lead to bleeding from right by the top where the fingernail meets the skin, and you can end up cutting part of the nail bed. The other thing that can happen sometimes is you might just be going for the fingernail, but you may accidentally snip off part of the skin at the tip of the finger. And yes, again, you will hear your child scream and there will be blood coming out. The fingertip has a lot of blood vessels in it, so it typically has a lot of bleeding that accompanies any kind of injury. Okay, take a deep breath. You'll remember that you watched this video, so you'll know what to do. And the other nice thing is your child won't remember this for too long. Allow the wound to bleed for a little bit, maybe 5 to 10 seconds, for example. The bleeding itself is a cleansing process, and it helps to wash out any germs that might have gotten in. After that, find a small piece of clean cloth or paper towel or gauze or something else that you may have handy, and put that on the wound and compress it. Use your hands to compress the finger and put pressure on it. You'll want to hold the pressure best you can for about maybe 5 to 10 minutes. That will help the wound to clot and also to stop bleeding. You want to avoid checking on it very frequently, because if you let the pressure go and lift up a piece of gauze that you may have on there, it's also going to break the clot that might be forming. So it's best if you just keep pressure on, keep it there for about 5 to 10 minutes, and just talk to your child. Just talk about some fun things so they don't remember this. After about 5 to 10 minutes, go ahead and take some pressure off and very carefully lift up the material that you have covering the wound and check and see if the bleeding has stopped. If it hasn't stopped or if it's still oozing, it's okay to put pressure on for about 5 or 10 more minutes to see how it does. However, after that, if the bleeding isn't stopping, it's time to get medical attention. Also, if you think the cut is very deep, so if you can see muscles underneath, for example, or fatty tissue inside the cut, you'll want to take your child to the doctor so they can check out that cut and see what to do with it. All right, after the bleeding has stopped, take a little time to gently wash the wound with soap and water. Use an unscented soap if you have one available. Just a real gentle scrub, nothing very deep, nothing very strong, because you may make it bleed again. And if you do, just pressure on again, okay? Otherwise, gently clean the wound with soap and water. Now, Avoid using rubbing alcohol. You don't have to use rubbing alcohol, and ouch, that will hurt. Also, avoid using hydrogen peroxide, because hydrogen peroxide kills healthy skin cells that your body needs to heal that wound. Some people like to use iodine. Don't have to. It'll make a mess. Also, soap and water will be just fine for this kind of a wound, because usually it's a small, simple wound that your child has. And then you can apply just a small amount of over-the-counter antibiotic ointment, something you might use on other cuts and scrapes, for example. Now, for little kids, you want to avoid using Band-Aids. Babies and toddlers can have a higher risk of choking because they may take the bandage off or put their fingers in their mouth and choke on the bandage. So only use a bandage for older kids if you want to, but not for the little tiny ones. Well, thank you so much for joining me today. I hope you found this information helpful. Please take a moment now to drop a comment, and also if you have a personal experience, please share that. I would love to read that, and I'm sure the parents would love to hear that also from you. Until next time, I wish you well. Bye-bye.